Alright, I'm gonna start letting people in. Hello, everyone. Welcome, welcome. Like this one,
Good afternoon, everyone.
Hi,
Hey, Taryn.
Hi. So this one.
I'll just leave it here.
Okay.
Can you guys hear me?
Yes, we can.
Okay. Am I coming in too early?
No, you're good.
No.
We're in the future with this owl that Kim brought, so.
Yeah, okay, cause I know in the past. Because.
It's good to have people that use it. I think everyone in my office is terrified of it, so. This is it.
If people have questions. It's possible to see people's faces on the screen.
Yes.
Send you the PowerPoint or maybe.
Yeah, you can send it to me.
I think you have to. Like open your screen up or whatever, and maybe Heaven could share her screen.
Well, I can't see people.
I mean, we're pressuring our congressional delegation to.
Hi, folks. Welcome, welcome. I am putting the agenda in the chat for you all to take a look. We're gonna get started in a few minutes. But while you're at it, you can take some time to introduce yourself in the chat, your name, any organization that you're affiliated with, or where you live in Prince George's County. I will model.
Yeah. I hope we
Yeah, Julian's screen, I'm showing people.
We can't go downstairs, you ain't sleeping.
Sharing my phone.
Can you hold my hand? You want me to poop?
Yeah.
Dad, first.
Yeah, because we can see them on Heaven's.
Yeah.
Power there is attached and that the only
We're just trying to figure out how to see you all, so hold on for 1 second.
I see my little nephew. Look at his little worried face. He's matching. Is that your brother? Oh, so cute. How old is he? He's gonna be a year in February. We always laugh because if you know me, I always have a worry face. Because my little brother is every he got it from me. We always like fun. We're like this. He's inherited our worry. And he's not even one. And he's already worried. People are like, this isn't painful. Like my face just doesn't. Yuki, yeah. His name means, no. Oh, yeah. Brother loves that kid. That's his wife, she's Puerto Rican. Oh, really? He's a black. Yeah. He looks like a light bulb. He's cheap.
Yep.
Okay.
All right, everyone, we're about to get started. Please continue introducing yourselves in the chat. I'm gonna pass it over to Julia.
Great. Hi, everyone. Hopefully you can hear me and see me. Sorry, I'm kind of like looking off camera into our agenda, which we have pulled up in our little meeting room. So thanks for joining our hybrid January quarterly Food Equity Council meeting. This is our first meeting of 2024. And appreciate you all being here. And it's nice to see some faces in person. So for our agenda today, we pulled it up, and I know Heaven has also dropped it in the chat, so hopefully you've been able to take a look at that. But we'll kick off with some introductions. I'm trying to figure out how many people are in the room. We have about 20 participants right now. So I think most of you have been introducing yourselves in the chat. I will say maybe we can just do some brief intros for anyone who's new. So if you haven't joined our FEC meeting before, or maybe it's been a little while since you've been here, this is an opportunity for you to introduce yourselves. So I'll kick it off for myself. I'm Julia Grenfelt. I'm a program manager with the Prince George's County Food Equity Council. I've been with the Food Equity Council for 3 years now. I can never remember, but quite a few years. And I do kind of a little bit of everything at the Food Council. And so one of the things I do is help kind of facilitate and run these meetings with my colleague, Heaven. So with that, I will just pause and let anyone who's new, or if you haven't been here in a while, please take yourself off mute and introduce yourself.
I can go. Hello, everyone. My name is Lakeisha Watson. I am an epidemiologist at CDC, specifically in their HIV surveillance branch, and am one of the co-leads for a geocoding and data linkage activity where we're able to now excitedly link our current addresses to census tracts, and then from there we're able to do some analyses with social determinants of health, which is pretty cool. And yeah, I am new to the council, and I am excited to be here. Excited to hit the ground running.
Great, thanks for being here. Anyone else?
Hey everyone, my name is Richard. I'm one of the co-founders at Secure Food. Just recently joined the council a couple weeks ago. And essentially our organization's goal is to tackle food inequity, and also use food as medicine to tackle chronic illnesses in underserved communities. Glad to be here.
Thanks, Richard. Happy to have you.
And I see we have one other person that's new in the chat. If you're comfortable, Ngonda, sorry if I messed up your name, but welcome. If you want to come off mute, feel free. Introduce yourself.
Hi, yes, my name is Gonda. I am new to the council. I am like a little bit on the younger side. I used to do like food volunteering with my college when I was in school, but I kind of got away from volunteering after graduation. So I decided to join the FEC just to give me the opportunity to be more involved in my community again. So yeah, I'm just happy to be there and look forward to this meeting.
Great, thanks for being here. Anyone else? Any new folks in the room? Okay, well, we'll keep on moving through. And if you haven't already done so, please use the chat to introduce yourself. And we'll kick it off with the rest of our agenda. And so we are doing a hybrid meeting today. So we will potentially have some more folks trickling into our meeting room, but we'll just kind of keep on moving through the agenda. And should wrap up by 5, but we'll see how the rest of the agenda goes. So I'm going to be facilitating kind of the first half of this meeting, and then I'm going to pass it over to Heaven, who's going to be kind of walking us through the second half of the meeting. So to get things started, we always like to review our foundational principles and goals, which I'm gonna try to pull up, and I think I can do that from where I'm sitting. And I know we typically try to do this to begin our meetings. We haven't done it in a little while, but I think since it's the beginning of the year and we're just kicking things off, it would be nice to kind of review this so we all have kind of a baseline understanding of kind of what we do at the Food Equity Council and what our goals are as we collectively work together. So we share the following foundational principles. We seek to secure safe, nutritious, life-sustaining food and believe that that's a human right. We know that there's a link between health and food. No individual or family should be deprived of adequate daily intake of food. Workers throughout the food system deserve to earn a living wage and be treated justly. The food system is an essential part of sound community and economic development and must be considered in all planning decisions. And agriculture is not a temporary land use and should be embedded in planning decisions countywide. And then lastly, every place matters. I'm going to scroll up and over so you can see this. And then the following, these are our goals for the work that we do together at the Food Equity Council. So we seek to develop and advance policies and programs and initiatives to address social determinants of food equity and related health effects. We integrate food system planning into all county economic and community development, both in the short and long term. Ensure the availability, affordability, and accessibility of healthy, sustainable, culturally appropriate, safe food for all those who eat in the county. Expand the reach and impact of nutrition programs for low-income people, including federal nutrition assistance benefits and emergency food assistance. Our goal is to create countywide awareness of the role healthy food plays in the overall health and well-being of the county and its residents. So again, these are linked at the top of our agenda. So these are always linked in the agendas we send out for these meetings. This is in our Google Drive folder, which has a wealth of other information about the work that we do at the Food Equity Council. So if you're not familiar with those resources, please do check those out. It's always nice to kind of level set and have an understanding of why we're all here today. Okay, we're going to keep on moving ahead. Just quick organizational update. So we are entering 2024. We have put together a brief highlights and year in review. Heaven kind of spearheaded this year, and this just gives a little snapshot of what we've done this past year. So I've linked this in our notes, so please do check this out. We had a lot of great wins and successes this past year, and it's really nice to share that all with you and to celebrate that. So I won't go into too much detail, but we just kind of highlight a few of our accomplishments with our food rescue program, our social media and website attention. So kudos to Heaven for spearheading our communications this past year. We have some highlights on our Food is Medicine program, and then a little snippet to celebrate our 10-year anniversary, which many of you attended, and then some plans for the new year. So please do check that out. I know Heaven's been posting that on our social media. So hopefully you can take a look. Come on in, you can take a seat. Yep. Okay, and then the other bullet point here under organizational updates, I think you all know by now, but we've shifted to a quarterly meeting schedule. We're no longer meeting monthly. I know there's been some wonky calendar invites, so some of our old calendar invites sometimes say monthly meeting, but just know that we will be meeting quarterly moving forward during this time from 3 to 5 p.m. Okay. So with that, we're going to keep on moving to a few different presentations, and then we'll have some time for community updates and work group updates after this. So if you have any questions or comments about that, hold those until the end. So our first presentation, we're going to hear from Bridget Warren, who's the program manager with the Office of Food Security. We just wanted to hear from Bridget and get a little bit of a snippet about what they've been working on there and updates on some of their initiatives. So Bridget, I believe you're on. Yes, I see you. So I will pass it to you to present.
Okay. And I'm not as familiar with Zoom because I'm used to using Teams. So talk me through this, Heaven.
Yes, so there should be a green button at the bottom that says share screen.
Yep, it just appeared.
Okay, great. And then you should be able to select the screen that you want to share. Okay, cool.
You see that okay? Minus my notes, hopefully? Nope.
Yeah, we don't see your notes.
Oh, okay. So you may well be familiar with our office, but I'm going to start from square one in case someone isn't. So we are the new, relatively new Office of Food Security, and we were created out of the work done in part by the Food Security Task Force in 2021, I believe. And we're part of DSS.
Hey, Bridget, just sorry to interrupt. We can see your notes. We just wanted to give you a heads up. It looks like
That's what I was afraid of. So
Yeah. I know how it goes. That's my worst fear.
yeah. Let me see if I can move the toolbar to get there. This isn't working, is it?
We can still see them.
If you hit the little screen next to the refresh arrow at the top, there's like a
A
little
little
arrow,
what?
TV screen.
I think if you go to slideshow,
Yeah, that's where I was, but my notes weren't showing. So okay, let's start it a little bit.
Here we go.
oh, that's
Oh,
it.
okay.
You got it.
Yeah, I can't see my notes, but you guys are good. So as I said, we were relatively new, and we began as part of DSS and continue to be housed there, but we were basically building off the work of other jurisdictions or other parts of our jurisdiction. I really can't do this right now. Hang on just a second. Let me see. I have way too many slides. So Heaven, how about if I send this to you?
Oh, okay, that works.
If I can get out of this. I'm really sorry, you guys.
No worries, man. Would you prefer we have Michelle and Scarlett here who are gonna
That would be
participating?
awesome.
Okay, so
Okay.
why don't we kick it to them and then you can email your slides to Heaven and we can get that set up and then loop back to you.
Sounds good. Thank you. I apologize.
No worries. And I think I have Scarlett and Michelle's slides too, so.
Could Scarlett then share? Because because Heaven was gonna share, but I think you're occupied. Oh, you want me to share?
Wait, hold on. Hold on. I should well, Bridget will send me her slides. That won't be take too long. So I can think I'm good to share.
Okay.
Yeah. It's on PDF. Is that okay?
Yeah.
Okay. Okay, cool.
All right, so I guess if you all can give a thumbs up as long to show that you can hear me okay? Great, okay. All right, so should I just start?
Yep.
All right.
Go for it.
Okay. Thank you everyone for giving us this time today. My name is Michelle Burton and I'm the program manager of the Prince George's Fresh program. Many of you all may have been familiar with Sydney. And so I just took over when Sydney had to transition from the Food Equity Council. So we're happy to share with you some of our evaluation results and methods. Our full report is on our website underneath the Food Equity Council piece on the Institute for Public Health Innovation. So I think the link is shared, so reach out if you want to see the full page.
Yep, it's also on the Food Equity Council's website under PP Fresh.
Wonderful. Thank you, Heaven. So we can go to the next slide.
Sorry, I'm muting. Okay, cool. And I'm just gonna mute everyone. Okay. There we go.
One behind. Oh yeah, if you could go back just one more. All right, so this is just a snapshot of some of the different reasons that reasons behind the impetus of the program. So we know that in our county, there's a high degree of residents living with one or more chronic disease, chronic diet-related chronic diseases or health conditions, sorry. So we know that diabetes is a major health issue, and we also know that this was highlighted in our community health improvement plan for the county. And so it was part of that was part of the reason for why we started this program. And then we also have a high degree of food insecurity. So you can see we have in the DMV region, about 48% of our residents are living with food insecurity. So I'm going to pass it on to Scarlett for the next one.
Yeah. Hi all, before I proceed into the presentation, I'm Scarlett Castro and I am the program assistant here with the Prince George's Fresh program, and I work closely with Michelle. A little bit of background on the initiative. By Informed Data, you know, the Prince George's Fresh program was born out of a gathering of private and public, you know, partners, of whom many are here with us today. Very key element partners that helped found the Prince George's Fresh program based on that urgency of food insecurity that the county was experiencing. So among those were the Giant Food, the Institute for Public Health Innovation, the Prince George's Healthcare Action Coalition, as well as the Prince George's Food Equity Council. Given the context that Michelle shared on the statistics of the county's food insecurity and chronic disease is what really prompted those goals in bridging the gap between food insecurity and chronic disease. For the program, we had 4 main goals, and that were to increase knowledge of and buying power of for produce, as well as address the root cause of poor health, support additional clinical treatment options, as well as strengthen doctor-patient relationships.
So I know this might be small to see. So that's why you could see it in greater detail, or you could see it up close with our report. But pretty much those that were part of the program were screened through 5 of our participating health clinics. They had to be a resident of Prince George's County. They had to screen yes for being food insecure. They also had to be an adult, so 18 years and older, and they were already diagnosed with 1 or more of the related chronic diseases that could have been hypertension, high cholesterol, prediabetes, or diabetes. So they could have had 1 or more of those. And then on the other side, you'll see the number of people that were enrolled. So 87 people passed through the program. The majority of them were Latinx or Latino. And interestingly, their insurance type, several had private insurance, several had no insurance, 37%, 12% had public insurance, and it was a mix of Medicare and Medicaid. But I will caution anyone for interpreting the private insurance, as there are some who may have had public insurance and may not have realized it, as this was a huge knowledge gap for many of our participants, because when we tried to find out their insurance, like we got all kinds of insurance. We got housing insurance and life insurance. So, you know, for example, an entity like CareFirst could be both public and private, and people may not know the difference. So that question has come up before. And the majority of them, just slightly over half, were between 40 and 59, and 71% of the participants' primary language was Spanish. So this was sort of the background of how we came to be. So first, it was a coalition of public and private entities, as Scarlett had mentioned. And we came together knowing that we wanted to address the unique needs, well, the special needs of our residents, and food as medicine came up as one such intervention that we wanted to do. And so collectively, folks went and researched different models. There was an example done in DC that still exists. It's called DC Green. And that was started within the Giant Food program in Southeast DC. And so given that model, we adapted that for ours in Prince George's County. And so that's what launched Prince George's Fresh. And that was I think the program started in 2020.
So now I'll be taking you guys through the enrollment process that took place from the fall of 21 all the way to the summer of 23. So the first step for a participant to be enrolled into the program was being referred, or they had to visit their doctor, which was one of, you know,
we had 4 to 5 clinics that partnered with us. And they were screened for eligibility, which Michelle mentioned those inclusion criteria. After that, the patient was referred to us, particularly myself, where I would reach out to the participant to just verify the information to ensure that they were interested in the program. And then we were able to complete the orientation as well as the enrollment process. Once that was done, they began to receive the $80 a month of
In order to
produce.
get that same.
Initially, we did provide it in a weekly basis, $20 per week, but we transitioned eventually to $80 a month. After that, participants were eligible to go into the Giant store to purchase their produce, whether that was fresh fruits or vegetables. And they ended up spending the vouchers for 6 months. So they were with us in the program for 6 months long. Next, Heaven. Yes, and in terms of the evaluation data that we collected, this is the timeline. So when you're reading the evaluation report, this can kind of give you a snippet of how we collected that data. Initially, at the beginning of that orientation enrollment meeting with our participants, we collected a pre-survey. And we had 87 participants. So at the beginning, we collected 87 pre-surveys. We also collected data from our participant advisory board meeting that was created, I think it was like in late 22, early 23. Participants from our 87, our sample, they were selected through an application process, and they participated in the PAB, short for Participant Advisory Board, for 9 months. And we also collected data from the lost to follow-up surveys that were completed in the middle of the program. These came about to see if any of our participants, were lost to follow-ups. We then sent them this additional survey just to ensure that we were able to collect reasons of why, they didn't complete the program, etc. And then finally, at the end, the post-survey that every participant had to complete at the exit of the program.
So yes, to answer Liz's question, Giant would send us an invoice of the purchases, and then we would pay Giant for those purchases. Yep. So just to give you a sense of our baseline of participants living with a chronic health condition, you can see the percentages there. And so again, it could have been any one of those or multiple of those conditions. And I'll just say that you also see an other line, as well as behavioral health conditions that was not part of the criteria, but we saw a significant portion of them living with also a behavioral health needs. So we just wanted to call that out, and also to say that our folks in the program may have been living with other health conditions beyond those that were indicated. And then, so this is the yay of the whole program. Is that we see that 98% reported eating healthier. We also saw other self-reported increases in improving their blood pressure, improving their cholesterol level and their blood sugar. Also, they saw an increase of exercising more, and also, 48, 20. All right, and then also a significant amount reported losing weight. So again, this is self-reported, but it's still good to know that the majority of them had a positive experience.
Yes, when it came to the behavioral changes, we did see statistically significant changes across the board for participants. We are displaying two questions. One here that we asked our participants, after you eat a meal without meat, you still feel hungry. And we can see that before, in our pre-survey, 32% of our participants answered yes to that question. And when we collected the post-survey, that decreased over time to 12%, meaning that 60% of our participants were no longer feeling hungry after a meal without meat. The second question that saw a statistically significant change was you don't eat vegetables as much as you'd like because they take too much time to prepare. We also saw that in our pre-survey, 32% of our participants answered true, and in our post-survey that decreased to 7%, seeing a huge improvement in this area.
Question,
Yeah.
and maybe you have already shared this. When you say post-survey, what's the duration between the before and after?
Yeah, so that was, it depends, because it would depend on the start date of the participant,
Yeah.
but yeah, 5 to 6 months.
So the pre-survey happened before the
Yeah.
start of the program, and then after 5 or 6 months. you get
Yes. And then the participants last 6 months in the program. So at the beginning, it changed a little bit, but majority of them, we took their post survey at 5 months.
Okay.
I just wanted to do a time check. How are we doing? Because I want to make sure there's time for all the other. folks.
Yeah, we're okay. Yeah, if you want to wrap it up in the next like 5-ish minutes,
Okay.
then we can have questions. after
So in the interest of time, I'll just try to go through as much as we can, but might have to skip a few. So also part of our results that we found were statistically significant was the self-reported change in BMI for our participants. So you can see the increase of those who reported being in a healthy weight category and a decrease in those who were reported in an obese or an obesity category. So. And we were able to get data from one of the 5 clinics that were participating. So this is the weight loss data from the participants from the La Clínica del Pueblo, one of our wonderful partners who were really the impetus, the reason why we started the program was for their patients. And so you can see in the green, the weight when they started the program, and in the blue, you can see the weight when they ended the program. But there is a caveat in that those participants that were from this clinic were also part of the DSME, which is the Diabetes Self-Management Education, although we did not evaluate that, or they were part of the other one was it was the pre-diabetes. Yeah, the DSME, but they were part of the the DPP. They were part of the diabetes prevention program. So I don't know how long they were participating with those, but that could have also influenced the results. But it is promising that we did see a significant change with those participants.
Yes, thank you, Michelle. And this is someone who has a background in nutrition, is a music to my ear to understand what were the top 20 produce that our participants were consuming. And we see here that citrus, banana, berries, tomatoes, grapes were on that top 5. The number on the side really indicates the number of times that particular fruit or vegetable was purchased. So for citrus, we see that it was purchased 333 times. Additionally, this data comes in handy for the future of the reiterations of, a 2.0. So we're looking forward to digging back into the data and see how we can continue to improve the program.
Okay.
Yeah.
Okay. So there are some limitations. Obviously, this was a very small program for 87, and it was a 3-year program. So we did have people who were cycling out, so they weren't, all enrolled at the same time, which is something that we would love to do, is to scale up if we're able to get the funding. It's self-reported with the exception of that one clinical data piece that was a real hurdle to get data sharing agreements with the clinics. That's another thing we'd like to address if we get the funding. And then we also know that there's a social desirability factor when people are self-reporting data. So we don't know how that may have influenced the results. And finally, the evaluation was done by us. So as those implementing the program, we're also evaluating it. So that comes with its own biases.
Yes, and lastly, guys, to close out our presentation, here are a list of things that we found successful in our program. We were a low barrier enrollment, meaning that we did not ask for a lot of requirements for that inclusion criteria, which opened the ability for many of our Latino population to be a part of the program. We also we had bilingual content. Myself and Natalia, as the community health workers, are of bilingual. We speak Spanish and English and have that cultural competency. We also found a lot of success on having the participant advisory board and their experience firsthand as they shared other experiences that really helped shape the program, and we were able to improve as we moved along. We also considered to have been a comprehensive program. We also referred our participants to other social services, whether they were experimenting, transportation, issues, housing. We were able to, just direct them in the right path. Again, I said bilingual material, so all of our content was both English and Spanish, and we had that adaptability to change as we went in the program. So initially I shared, we started with $20 a week, every week. We saw that was a barrier for some of our participants, so we transitioned into an $80 a month to just decrease any burdens of, having to travel to the store multiple times. So that was just a few among the other successes that we had.
Yep. And so we're almost to the end. So we just have our next slide, just some feedback that from our participants. I would say we did get a lot of positive feedback from our participants. The only thing that we heard often was that, once the program ended, there wasn't, another way to continue that, because that need still persisted, and the funding had flowed, so there wasn't like a neat handoff. So that's something that we'd like to figure out. I mean, this was a great first step, and now I think we're really excited about the number of iterations of food as medicine programs throughout the country, and with each one having their own special components. And so that we'll be seeing, what model persists throughout, and as we'll be, continue to apply for funding and taking these lessons learned and applying that, for this next phase. So thanks for your time.
Awesome. Thanks, Michelle and Scarlett. I'll just kind of give my kudos to the two of them, and also all of our FEC members who were really involved and instrumental in getting this program off the ground a few years ago. It was really just this kind of ragtag team of FEC members who had an amazing idea and wanted to make it work, and started meeting and brainstorming and really put this together. And you saw the results, so it's really impressive. So kudos to you all for this program, and thanks for sharing the results. And if you haven't had a chance, please do take a look at the full evaluation report. It's really comprehensive and has a wealth of information. So we've been trying to get that out to partners and community members. And we've really received a lot of interest among both regional and also national partners who are looking at implementing kind of similar programs, and everyone seems to be really looking for models. And this is a great one. So yeah, with that, I think we can just open it up to questions. If anyone has any questions for Michelle or Scarlett or anyone else on the call, we can take a few minutes for that, and then we'll go over to Bridget for her presentation.
I see, was that the question?
I think we answered this
Oh, you
one,
did.
Liz. Yep, the Giant was reimbursed for that amount.
Okay.
Julia, I've got two quick
Yeah, go
questions.
for it.
So I'll try and be brief, and I haven't read the full report, so forgive me if this is in there, but First is I'm curious what the like redemption rate was for the vouchers. Were there participants who didn't fully redeem their voucher value? And were you able to kind of pulse those participants on why?
Yeah, so we found on average, the average participant spent $50 out of the 80. But we think why is because this was a novel technology platform. This was a massive job for Giant with very little reimbursement on their end because they had to handle their large inventory and change it. I didn't know much about grocery stores before, so I learned that they change their inventory every month. And we first started with just a handful of Giants, and then we expanded to the whole county so that it could be more accessible for people who maybe their clinic was in one part, but they lived in another place. So that was another example of being adaptive. But because it was a novel technology, there were some barriers of people perhaps misunderstanding how to access it. The way it was set up was that they put in their Giant card number, which is a phone number, but there's actually a lot more to it of how there's like different, it's like, it could be networked to other accounts. And so if people had any issues with that, then we lost a lot of their willingness to come back because there was a fear of being embarrassed. And so some people intentionally bought very low amounts just to test it out because they were afraid of being at that counter and not being able to cover that. And there was a line. And so, expanding it to the other stores. And there was being a completely new program and also being so low barrier. We didn't require any documentation. We didn't want that to be an issue, but some people thought that it wasn't a real program, being that it was so small. So kind of like getting that credibility and establishing that trust, I would say kind of goes hand in hand with the purchase.
That makes a lot of sense.
Yeah.
My second also try to keep brief question is, I'm curious too, if you hold the participants around, I know you mentioned you refer them to other like relevant social services, but like wraparound services, like cooking instructions. And it like if there's some interest in that in future iterations.
Yeah, when we did the participant advisory board, a lot of the participants that did participate, they did show their interest in that. So we did get a lot of feedback for the future iterations to do nutrition education in even like fitness component to add that component into the program. And also like more community based, like they wanted to like have walks or meetups at the park. So it's very interesting to see all the things that they're, maybe the program kind of like sparked that change in health and wellness that it's really nice to see their interest.
I just wanted to add that in addition to working with Giant with them letting us use their platform, they also offered their nutritional services at no cost. So we didn't really highlight that as much. Participants were highly encouraged to take at least that one at no cost nutritional consultation with one of the registered dietitians. And they could access that virtually over the phone or in person. And then they were encouraged to participate in the Giant wellness lifestyle courses, which included cooking classes. They have a TikTok channel. They have online resources.
Way to go, Giant.
Yes. Under Leslie Jefferson's leadership, Giant has a lot of options for folks that I don't think they're so aware of. And so we were trying to get them connected with those services. But I know that time was a huge barrier and maybe people's perceptions of health education. Some participants in our advisory board indicated they thought they didn't participate because they would feel judged because they hadn't engaged with the nutritionist. And so they assumed that was what it would be. So that was some of the feedback that we got. And also to gamify it. We also got people asked for 2-minute educational clips that they could do while waiting for their food to be microwaved. They wanted things that were really quick that they could do instead of budgeting like a whole hour of education. Sorry.
Yeah, great questions though. But yeah, thanks for sharing that. That was definitely a huge part of what we wanted to include in, the first iteration of the program. And specifically because Leslie was a huge part of the original team that put this program together. So the Giant Healthy Living team has just been like a huge resource, and I will just put a plug for anyone who is interested in nutrition classes. Those are all on their website, and they're really informative and just great resources for anyone who's interested in checking that out.
Yeah, and I just want to add that they were bilingual.
The top pastor to come and pray for his who is already died and the family.
Yeah, so we did have the Spanish nutritionist as well as the English speaking. So yeah, as the program went and we mentioned that we were adaptable to change, we tried to like change the way we not only offer those classes and consultations, but just to how could we facilitate that, especially for those that might not be like technology savvy.
Yeah.
And just scheduling those appointments. And I think that at that point it was a huge, change.
Definitely. Okay, Liz, do you want to ask your question? And then we're gonna keep moving so we can have time for Bridget's presentation after that.
Yeah, I was just wondering if Giant was able to provide any metrics as far as like additional costs or benefits that they saw in implementing the program. I'm just thinking if we want to expand additional grocers, they might benefit from knowing like what it took to implement the program and what benefits they might have seen.
That's a great question. And I will relay that to Leslie and to see if there's anything that she would like to share with us that we could include. That's a really good suggestion.
Yeah, thanks, Liz. Okay. With that, I also see somebody dropped the healthy living information in the chat and also Leslie's contact information. So thanks for sharing that. Bridget, are you ready to present? And I think Heaven can pull up slides.
I'm all set, and maybe Heaven can do the slideshow view. Thank you, Heaven. So starting again, I'm Bridget Warren. I'm the program manager at the Office of Food Security for Prince George's County. And this is our office update. Next slide, please. And my screen's frozen. There we go. This is our who, what, and where on the third slide. Heaven, I'm sorry, I jumped ahead. Here's our who, what, and where of the Office of Food Security. Previous slide. There you go. Thank you. We're relatively new, but we're housed at the Department of Social Services. And you probably know that DSS has been involved in food security through SNAP and other programs for many years. And during the pandemic, because we knew food assistance providers needed help, they asked the Food Equity Council to coordinate meetings and provide support services for our food assistance providers in the county. Next slide, please. We're focusing, pardon me, many of our efforts on these zip codes. They're the areas of greatest food insecurity in the county. And we're kind of combining these with the next slide, the healthy food access, healthy food priority areas in the county. And I know many Food Equity Council members are aware of this effort. This was a 2020 bill adopted by the county council, and it gives new grocery stores who are locating in the healthy food priority areas an incentive to do so. They get a personal property tax credit and other benefits with our Economic Development Corporation. And because there's been a census since this map was adopted, or this definition was adopted, it's being updated currently. Next slide, please. So actually, our County Food Security Collaborative met today, and it was started because we know that a single office with two people, myself and my colleague, Kyra Cook, who is our food assistance and outreach coordinator, was not able to do what we need to do in terms of food security in our county. So in the past, we've had agencies who come together around, project, grant opportunity, a specific issue that needs attention from multiple agencies. And that work has happened on an ad hoc basis. And we wanted to strengthen county agencies' collaboration and communication. So we established this Food Security Collaborative. And as I said, we meet quarterly, and it includes everyone from the Office of Food Security to the Extension Service to DOE and the Soil Conservation District and lots of other agencies. Next slide, please. We're also doing vulnerable population outreach, and Kyra, again, has started as food assistance and outreach coordinator, spoke last month at a lunch and learn opportunity for the coordinators of senior resident housing facilities, and talked about the benefits that are available to their residents, because so frequently elderly people just are not interested in receiving SNAP for a variety of reasons. So it was presented as an opportunity to improve your health and wellness. And we all know that SNAP provides significant health payoffs. So we're hoping to see more people through the nutrition sites that are run by the Department of Family Services. Kyra will be there speaking about the benefits available to residents one week and follow up the following week with SNAP enrollment. I'm kind of focusing on what Julia asked for, and that is community gardens and healthy corner stores. So we're hoping to, again, being guided by the food insecure zip codes and our healthy food priorities areas, to establish gardens that will give residents access to fresh, healthy food that they've grown that is also culturally relevant. And gardening frequently improves both physical and mental health. So to get this going, we're going to be working with other agencies. And just as an example of collaboration within the government, the Soil Conservation District can assist with stormwater plans. Master gardeners and University of Maryland Extension staff will provide technical expertise. As your cucumbers are getting eaten by cucumber beetles, you'll be able to get in touch and get assistance. DOE, the Department of the Environment, now has a mini grant program that's for community gardens that are using regenerative processes. And that can, if everyone's doing what they need to do in terms of community gardening that's regenerative, residents and gardeners will be eligible for $9,500 for a garden. And we've solicited and received all sorts of seeds from our local businesses and seed companies. So with DOE, again, providing leaf grow to fill raised beds, and we'll be bringing a gardener coordinator on board, we should be able to establish and run new gardens in the county. We're looking at 12 beds per garden, and we're hoping to do 3 to 5 gardens this year. And then as a backup for residents who are interested, who are food insecure, Park and Planning also runs a number of very large community gardens, and they plan to bring more online within the next year or two once they work out infrastructure problems. Next slide. This is a map that Kyra did, and we use the community garden master list, which a lot of people are in the Food Equity Council are aware of. It's also a collaborative effort. So these are our existing gardens mapped, and now we'll use the zip codes that we focus on and the healthy food priority areas to figure out where we'd like to establish our new gardens. Now we're at the Healthy Corner Store initiative. The Healthy Corner Store initiative encourages local corner stores, independents, to stock fresh produce. And this, I want to back up a little bit and say that the Healthy Corner Store initiative was something that was considered and worked on by a committee within the health department with Food Equity Council participation and support. And because of staff changes at the health department, the program or that committee kind of faded away. However, in 2022, there was an opportunity to use a grant funded model to try it out in our county. And that's what we did. And the next slide, the funding came to us through the Food Trust. And so we are now working with them to provide technical assistance and training for this new program in 2024. They developed this model, the Healthy Corner Store, in Philadelphia. They also worked in Newark and other Pennsylvania jurisdictions. And they provided the funding, as I mentioned, with Anthem for our Healthy Partner Store pilot in 2022. Because our office has limited capacity, we decided to go with the Food Trust as this year's contractor, in part because they can supply all sorts of tested materials, and their materials have also been made into a SNAP Ed toolkit, which is very helpful. The booklet pictured there is a planning department document that was done with a food equity planning grant that they received from the planning department. And it put together a lot of information that's very similar to the food trust, but because of our limited capacity, we just felt like, let's go with the food trust materials rather than reinventing the wheel locally. So next slide, please, Heather. I'm sorry. This is the location of our pilot in 2022. Vivian Perez is the owner of Mimi's Market. She had just acquired the property when she was approached by our healthcare educator, who's pictured there, Cynthia Brown. And her store was very welcoming to this program, I guess in part because she was new, and she also really believed in healthy eating herself. Next slide, please. These are sample materials for our store owners and for the in-store events to promote them. And the Heart Smarts is the nutritional education piece that Kyra will be doing at the stores. It includes food samples, recipe cards, and a coupon for customers to try showcased healthy foods. There are a series of nutritional lessons. And when I say nutritional lessons, they're really more conversational exchanges that take place in the store, but they focus on produce, fruit, vegetables, sodium content, calcium, healthy proteins, healthy snacks that you can put together, and a lot more. It supports the customers in making healthier choices, and it also encourages traffic to come into the store, to be very frank. This is also a nutritional program that was created by the Food Trust. And we hope to work with the health department in the future to have community health workers do health screenings before and after the program begins in the store. Next slide, please. These are some of the samples that of tastings that Cynthia Brown did during the pilot. As you can see, there's that one gentleman who was being really goofy, but enjoyed the coupons. In our county, as we were just discussing in the previous presentation, we have a lot of people struggling with diet-related illnesses. And this is an opportunity to give our residents the information they need to make healthy choices. During the pilot, Cynthia discovered that lots of people were unaware of that their favorite foods were high in sodium, and especially people who are coming home, they have very little time to put together a meal. They're working long hours. It's hard to think, let's make adjustments. But after trying some of the foods, getting the coupon to use in the store to purchase the food that was showcased, some people were willing to consider the changes that they needed to make. And although we didn't do any screenings like Prince George's Fresh, we hope to do that in the future to see whether people's behavior changes. Next slide, please. So we have some challenges that we've encountered, and I'll go through them, and then hopefully Kyra will jump in to add. Some of the challenges experienced in the pilot are overlapping with our current project experience. Picking the right retailer is very important to convince a store owner to sell healthier products and then understand how that might attract customers to the store. You have to understand what the owner's needs are. Location's very key. We'd like to be close to transportation hubs, whether that's the metro, bus stops, or a school where people are coming and going as they pick up their kids. We want it to be want the store to be conveniently located, but we also want it to be someone who's open to healthy food and beverage choices. Recruiting stores that are interested in all of this and committing to the program can be pretty difficult. And to do so, we need to reduce the financial risks. When we say, please give up the shelf space that you've devoted to Cheetos for years and give that shelf space to fresh produce, it's sometimes a difficult sell because they haven't had anyone coming in and saying, can you please have oranges, because they don't have oranges on their shelves. So we need to help businesses who have hesitations. And we do that through some training, but recruiting people into the program remains the challenge because they won't know unless they participate. So that's why we have all the materials that we want them to understand how they can increase their sales through displaying produce, locating it correctly in the store, that sort of thing. And then we need to attract residents to the stores. All the participating stores have to accept SNAP and WIC. And launching this program within the county government, as you can imagine, has its own organizational administrative problems. So we have, for example, the HeartSmart coupons are given out in the store. To do that, we have to have a memorandum of understanding with the store owner agreeing to accept those coupons and redeem them and be reimbursed by the county. That required the procurement division to be involved and the Office of Law. So doing this once may be a heavy lift, but hopefully in future years, it'll go much better, much more smoothly. Kyra, did you want to add anything?
I think you primarily covered it. The main challenges are just that risk. I think the financial risk versus, you know, carrying your tobacco products or being located near a liquor store. Like, how do you give up those things for fresh produce? You don't know, it's a risk, but I think you covered everything. That's one of the main drawbacks. We've also heard where they might be a newer location or they might not have a whole lot of traffic getting in. So they just need a little assistance with the promotion part.
Next slide. One of our office functions is to gather, analyze, and share data that can guide both our office efforts and the county as a whole. It's a core function of our office. And last year, we designed and distributed a census of food assistance providers. That was both for emergency planning regionally and locally. And we also wanted additional information to inform what our office does in the future. We wanted to understand how the entities I mentioned and other local organizations can serve residents. And next slide, please. This was grew out of a Council of Governments program to build a regional GIS layer. And that way, as residents, for example, who live in Mount Rainier might be going across the district line to get food in the case of an emergency. And during the pandemic, there was no regional information that could let us know where our food assistance providers are, who might have other counties or the district's residents coming there because it was more convenient. So this is a GIS layer that the Council of Governments commissioned a consultant to build, and we had to do a survey one way or another to do this. And so we decided to build off that effort. And next slide, please. And it was a long, very comprehensive survey, I would say, and that's being charitable. It was very long. And as I said, it builds on that, builds the information for the GIS layers to be created. It answered emergency management questions that we had, and it gave our office information to proceed. Next slide, please. And our emergency management planner was gleeful because he's a big data nerd. He was just thrilled to find out that 75% of our food assistance providers were willing to partner with the county. And he had also all sorts of details that he needed to gather about the capacity of our food assistance providers to serve food or distribute food, where the loading dock was located, if they had a loading dock, and how their kitchen was equipped. Next slide, please. Our office also does legislative responses. An example from my inbox yesterday was a bill that proposes a food desert study that builds on a 2019 bill that asked the Department of Housing and Community Development at the state level to explore and understand food deserts. So the new bill, the 2024 bill, builds off of that and requires a new study to review the number of food deserts, what projects have been funded by the previous 2019 work, what their impact is on residents, and strategies to improve food deserts. So that's the sort of thing that we respond to both locally at the county level and provide information and comment to the intergovernmental affairs team and agency leadership to take a position or not on a bill. Next slide, please. Maryland market money is probably familiar to a lot of you because it's been in place for several years. This and the Healthy Corner Store Heart Smart coupons are examples of the nutrition incentives that we would like to expand in the county. And Prince George's Fresh also had a great incentive. Next slide, please. So these are the foundational recommendations that came from the County Council's Food Security Task Force, and FEC, I should say, was the consultant to the task force. And they explored the problems that many food assistance providers encountered during the pandemic and came up with this basic list and another list you'll see in a moment. We've highlighted what we've started working on, and we feel we've made progress. So we've got the Food Security Office in place now. I mentioned the data work that we've started, and we're trying our best to increase resident participation in federal benefits. Next slide, please. So this is a list of the policy and program recommendations that came out of the Food Security Task Force. And you can see again that we've highlighted what we've begun work on. In addition to what's outlined by the Food Security Task Force, we have a list of other strategies we'd like to expand or explore in the future. And well, one is the curbside groceries, which is already setting up new sites after we were able to provide a lot of data to them. Curbside groceries, if you don't know, is a mobile grocery truck that is a project of the Capital Area Food Banks. And it works in the district and parts of Prince George's County. As I mentioned, we'd like to expand nutritional incentive programs in the county, and certainly food as medicine because it's so important in our county. And in the future, we'd like to do a program called Grow a Row, where you share your garden's bounty with local food pantries and work basically in concert with volunteers to do that. And then the Prince George's County Food for All is what I hope will be a public-private partnership to have basically a fund of money to draw on both for food security initiatives and in cases of emergencies like the pandemic. So that's it for me. Are there any questions, comments?
Thanks so much, Bridget. Appreciate it. Yeah, go for it. We have a question in the room.
Yeah, Bridget, really nice to meet you. Thank you so much for that comprehensive overview. You and Kyra sound like you tackle a lot. I'm really curious. I'm not familiar with the Community Food Security Collaborative that you mentioned, but I heard you say it's just you and Kyra. Is that something that's open to residents? Is that something that's exclusive to individuals in your office? Or I'm just, sounds like there's a lot of overlap between what you're working towards and certainly some of the goals of the Food Equity Council. So just curious if you can elaborate on that.
It's actually a food security collaborative for county agencies. So it's an effort to improve what we do internally and not duplicate efforts, but also share resources. And there's a lot of good work going on in our agencies, but it hasn't been under one umbrella as we're all working on food security. And we're just trying to give opportunities for agencies to connect with each other and basically leverage those resources that we have to do good work.
Thank you.
Yeah, thanks for sharing that, Bridget. I think, there's a lot of opportunity to kind of connect the dots between that group and this group. And, we can brainstorm this more moving forward, but I wonder if, maybe we can get regular report outs from you on what that group is doing, or even bring in speakers from different county agencies to join these meetings, just to kind of bridge that gap a little bit between both the groups. Because I think what you're doing is really important. It would be great to kind of integrate some of our FEC members into that work.
Will do, because I was just talking about a way to set up a website page that people could access that would essentially share the information that's being shared in meetings.
Great, that'd be great. Awesome. Michelle.
Maybe this was covered, but Is there an incentive, like a tax incentive for those businesses that are selected to be the healthy food corner store?
There is an incentive. It's part of our contract with the food trust, but basically they'll be able to purchase or select equipment for the store. It could be a countertop cooler where they would keep healthy beverages or to-go snacks that are healthy. It could be a repair of a cooler that they currently have. They might be able to purchase a new cooler. It depends on what they want for their store. And it could be signage, display cases that would give you, baskets to range plantains and avocados and that sort of thing. So that incentive is there for store owners, but first you have to get over that first barrier of stores being a little hesitant about participating, and understandably so, because a lot of the store owners are stretched very thinly as is. So just to have someone who's not staff come into their store and do presentations, and then they have to teach their staff how to accept the coupons, how to collect them, redeem them, that sort of thing. You can see it's an additional weight on the store. So we definitely want to incentivize their participation.
Great, thanks, Bridget.
I have a question, follow-up. So I wonder, Bridget, if you guys have thought about expanding it to mobile food market type of, model, aside from healthy corner stores, which is like, brick and mortar kind of thing.
Right now we want to focus on just 3 to 5 stores this year, and we'll see what we learn at the end of the year. We are working on a way for mobile grocery stores to be able to participate in the Maryland Market Money Program. But right now, we want to just get through a year, and then we'll evaluate where we are, and definitely we'll consider the mobile markets as possible means. You and I can talk about that more later, I guess. But right now, this is what we're set to do for the next year or so.
All right, thanks.
Thanks, Bridget. Yeah, I'm just gonna comment on the question in the chat or comment in the chat from Mara. This is a link to the Montgomery County Food Council's Farm to Food Pantry program, which is an awesome model. And it's a really cool way of sourcing local food from local farmers for food pantries in Montgomery County. And just to comment on your comment, Mara, yes, I totally agree. It'd be awesome if we could replicate something like that in Prince George's County. That's something we've pushed for in the past and we've talked a lot about. So always happy to chat further. And Bridget, if the Office of Food Security is interested in kind of collaborating on something like that, we would love to continue that conversation, because I think it's very much needed in the county. Okay, I'm just gonna, Michelle, we have one quick question, and then we're gonna keep on moving so we can get to the rest of our agenda.
Okay, well, just a comment. So I'm a resident of Greenbelt, and something that incentivizes my neighbors into community gardening is the compost program they just started. So that was something that I just wanted to highlight as a additional incentive for getting people to participate who would normally do it. And then the other piece I was curious about was you mentioned food deserts, but do you also take into account food swamps? Or as a resident of the county, I can go through areas where there's a lot of food options, but I'd have to drive kind of far to get to a place where they might have some produce options. So I haven't found much literature on food swamps, and I was just wondering if that was considered as well with prioritizing areas.
I agree with you that food swamps should be included. That was one of my first thoughts, but what I mentioned was a bill in the Maryland Senate. And originally I thought, why are they using food deserts alone, not food swamps being added to that? But when I went back to the 2019 bill, I understood that they basically were carrying over language from a previous bill. I agree with you completely about the food swamps, and I can send you some links. There's definitely information out there. And to back up to your compost question, were you saying that your gardener or your neighbor's participation in the county compost program would encourage them to garden?
Yeah, no, I was just sharing
Okay.
anecdotal that they started gardening because they got an incentive through the composting. So I was
Okay.
just highlighting that as a good thing.
I just wanted to understand what you're saying about
Yeah.
that. So, and it is,
Yeah.
I should say, we're one of the few counties in the country that have a curbside composting program, if not the first to do that countywide. So we're awesome
Thanks, Bridget.
in the
And thanks-
compost regard.
and
Thank you.
other regards too. Yeah, and I think that's a good segue, especially about your comment about food swamps. That was something that was very much incorporated into the work that the Food Equity Council and the Health Department did with the Healthy Food Priority Areas map. It was specifically trying to look at, what are where are those areas that are actually food swamps, and kind of where is that high density of unhealthy food options located. And it's not just about the density of healthy food options. And that is something that one of our work groups worked on, and we're gonna switch gears a little bit and dive into some work group updates. And we'll hopefully hear a little bit about what that work group had been doing in prior years. It's been a bit on pause for the last couple of years. So Heaven, I will pass it to you to jump through this section.
Yeah. Hi, everyone. I'm Heaven Jordan, Program Associate with the Prince George's County Food Equity Council. We're just gonna go through some updates of our work groups and committees. So if you aren't aware, our work is categorized in these 3 bucket areas. So grow food and preserve farmland, equitable access to healthy food, and strengthen the local economy. So when you also go on our website, you can kind of find our work in those 3 bucket areas as well. So we're gonna run through our 2024 active work groups. We're gonna start off with the Urban Ag and Land Use Planning Work Group, and I believe Ken and Liz are gonna go over our highlights and goals and resources needed from FEC.
Liz, did you want to start or did you want me to start?
Yeah, if you wouldn't mind, I'm just packing up some orders, so I'm listening.
All right, no problem. So this year we had a couple of initiatives. One was working on the Urban Ag Property Tax Credit. That was legislation that was passed in 2015 with support from Delegate Lehman and other council members when Delegate Lehman was a council member. And unfortunately, it's not being interpreted by our Office of Law in the way that the bill was intended. So very few farmers have had the opportunity to take advantage of this. Well, no farmers actually taken advantage of this property tax credit, which is problematic. So our group has been meeting over the last year to kind of talk about what we would like to see in a county bill. Also recognizing that there's some state enabling legislation that limits what we can do on the county level. So Heaven has reached out to and others to Delegate Lehman's office to kind of talk about is there a possibility for changing some of the state enabling legislation to make the county legislation, the different counties legislation a little bit more, open and easier to access. So that's something that this group, the main focus of this group over the last year. Another thing that we've been working on is developing some sort of like wireframe or permitting matrix for urban farms in terms of like what they can and cannot do since the new zoning ordinance has gone into effect. And also sort of clarifying what the roles are or what the requirements are for our traditional, I'll put that in quotes, farms that are agriculturally assessed and they already receive, certain benefits from the state and the county in terms of their property taxes, but they're not subject to the same permitting and requirements that our urban farms who are on residential lots would be subject to. So we kind of wanted to help farmers with clarifying that. So we worked with UMD's Ag Law Education Initiative to do some of that work, and some of their Brinsfield interns helped kind of like go through our zoning ordinance and help give us some ideas in terms of how we might set that up. This is very much a work in progress. I talked to them just this past weekend at a Future Harvest conference. So they're hoping to continue this work this summer with some of the new interns. In terms of goals and priorities for 2024, continuing to work on this state enabling legislation change, and also, kind of working maybe with the Office of Law here to see if there's any wiggle room in terms of how the legislation is being interpreted. And the other thing is to work with Councilmember Ivy, who is interested in helping to make amendments to our current property tax credit to make it hopefully more usable by urban farmers in the county. In terms of resources needed from FEC members, we'd love for more urban farmers to participate in our work group meetings, which are usually the third Thursday of the month at 3. So you can kind of remember that. And we will definitely need some testimony assistance. If we do make a change at the state level, there will be testimony needed there as well as at the county level. So all of this is very much in process at the moment, but those are the main things that we're working on right now. Liz, I don't know if you want to add anything. Or anybody else that's on the Urban Farm Committee.
I don't think so.
Yeah, I think you covered it all. And if you're interested in joining those committee meetings, feel free to reach out to me or Kim or Liz, and we'll be happy to add you to the invite or forward it to you.
Thanks, everyone.
Next, we're gonna go over the Food as Medicine work group, which I believe Taryn will be covering. Taryn, are you on? I think I saw you.
Be nice if I'm muted. Hi, good afternoon, everyone. Thank you, Heather. The Food as Medicine work group, we started, I think actually back in maybe 2019, we started, and we've had some good years. As you can see, the program itself ran from 2021 to 2023. And some highlights from 2023 is that we concluded the pilot program with the 87 enrolled participants, and also the completion of the evaluation report. I'd like to publicly thank everyone who worked on the evaluation. Sorry, names are really Michelle, Scarlett, Evan, the IPHI team. Thank you so much for your work on getting the evaluation report. And then they reported on it earlier, so everyone has seen it, and it is available on, I believe, the FEC website. So our goals and priorities for 2024 is to procure funding to implement follow-up Food as Medicine initiatives. So if you have any leads or sources for funding for this program, please let us know. And then also engage in partners with statewide across Maryland to explore the Maryland 1115 waiver so that Food as Medicine initiatives can be funded through Medicaid. And then resources we'll need from FEC members is involvement in that work group. Right now it's currently on pause because we don't have anywhere to house it where that organization will take the lead. So if you're interested, please let us know. We'd really love to get that work group off the ground and going so that we can have more permanent financial sources to fund Food as Medicine initiatives, not only in Prince George's County, but around the state. Our work group meets every, I believe, 4th Wednesday. So we will be meeting tomorrow at 3:30. If you're interested, you could drop it in the chat, reach out to Heaven or myself. And our co-chair for this group is also Leslie Jefferson from Giant. She was not able to be with us today, but thank you all.
Hi, parents. This is Anna from Linda Ben. Can you just tell me how many people are part of the work group and what organizations are participating?
Which work group? The the Maryland 1115 or the Food as Medicine?
Food as Medicine, I'm sorry. Yeah.
Okay. Regularly, maybe around 7 people. We have, so it's the Prince George's Healthcare Action Coalition, the Food Equity Council, Giant, myself. So we have members from those core groups that attend.
Okay. So I have an idea, but I'm gonna kind of like pass it on to Julia and Heaven first. If it kind of works, I'll share it to the work group.
Okay, an idea to support the work group.
Oh, yeah.
Yeah, that'd be great. Yeah, it's historically been kind of run by the Prince George's County Healthcare Action Coalition. We've done a lot of like co-leading work groups in the past, and that's one of them. So yeah, any ideas to kind of expand it or figure out strategies to move forward would be great.
Okay.
Okay, thanks for your note, Dr. Bello. So yeah, I'm just jotting down folks that are interested in joining that work group, so we can reach out to you after the meeting.
Yes, thank you so much for your interest.
Yay, I see a lot of interest in the chat. That's exciting.
And also through his friends.
Awesome.
Work group.
Oh, gosh. Okay, I think we're here. Yeah. All right, so next is Food in Jails Working Group. So this working group is led by PG Changemakers and Life After Release, and supported by the FEC. So we essentially just believe that food in jails should be better. I mean, it's harmful, honestly, right now. So we last year we hosted 7 community conversations around food in jails that anyone can join, but they were pretty much primarily focused on folks who were impacted by the carceral system, them sharing their experiences and letting folks in the community know about their experiences. And then we completed surveys, food environment surveys, to really understand what the food is like in the carceral system currently and how it can be improved. And that exceeded our expectations because our goal was actually 20 and we received 23 completed surveys. And then now we are looking to draft legislation in Prince George's County to be introduced by the county council, led by Councilmember Orieta. And this is a pretty much comprehensive bill. I don't know if you guys are aware, but in DC, they have a similar bill. And this bill is pretty much modeled after that, but tweaked for Prince George's County. And it includes really great things like farming and growing produce in the jails, teaching them work experience, giving them work experience. And also just giving them healthier options and also setting guidelines, because right now they're with, school meals, there are guidelines. Jails do not have those same guidelines. So that's pretty much what the bill would do. So what we really would need from you all is just support when this is introduced and getting the word out, testifying and signing on sign-on letters from as an individual, as a resident, and as an organization. We really just need to get as much support out as possible. In these meetings, we have meetings once a month as a full coalition. If you're interested in joining them, please let me know and I will be sure to add you. Let me see. Are there any questions? I think someone's hand is raised. Oh, Liz.
Yeah, I just wanted to make you guys aware, if you didn't already know, I saw a bill that recently got introduced at the state level that prohibited inmates from working in agriculture. I can follow up with an email, but I'm not sure what the intention of that was, but it, to me, doesn't make sense that they can work on highways but can't grow food.
Yeah, please pass that along. I would love to take a deeper look at that.
Okay, I'll follow up over email.
Thank you.
In heaven, tomorrow we have a meeting with the PGC coalition, so you're welcome to help us promote food in jails and whatever you need.
Okay, thank you.
9 o'clock.
Oh, I did have one more question. It was about the task force. I was wondering if FEC was involved in the task force. I think that was maybe that was that back with Bridget.
Oh, the Food Security Task Force?
Yes, exactly.
They were the consultant, Liz, and it was a county council effort. So Food Equity Council coordinated and served as consultant on the project.
Oh, okay. It now if that relationship has ended, or would they be able to be part of like the actual group, or do they need to be a independent third party?
Well, it was like a short-term contract to coordinate the task force work and then produce a report.
Gotcha. Okay, thank you.
So are you talking about the collaborative?
Yes.
Like
I'm sorry
the-
that I responded earlier. I think, I'm not sure who asked me, but right now it's a county government collaborative. And well, we'll probably share information from it. It's to have our county agencies better coordinate and build off each other's work. That's not to exclude anyone. It's just to improve what had been a little disorganized in terms of pandemic response.
Thanks,
Gotcha,
Bridget.
thanks.
Now I'm gonna move on to the farmers market support working group, which is also led by me. So this group has been on a little bit of hiatus. We mainly because of like our farmers market managers' busy schedules. We met last spring, but what came out of that was a comprehensive farmers market listing. We heard from market managers, farmers, and we partnered with Maryland Market Money to kind of promote farmers markets in Prince George's County. So this listing has like all the dates and times of the farmers markets in Prince George's County, what benefits are accepted, and any vendor opportunities. And we hope to scale that up a little bit this year by making it bilingual and creating a bilingual toolkit to enhance outreach and continuing to connect Prince George's County farmers to farmers markets through this resource. So resources needed from FEC members and stakeholders in the community, just support with outreach. We'll be having like a printing budget. We have lots of flyers that we can give you all, and also just sharing with your networks and sharing on social media. I know there are some folks who are serving food insecure populations, and we really want to make them aware of the fact that they can go to the farmers market and use their SNAP and WIC benefits and get matching benefits through Maryland Market Money. So it's just an opportunity for everyone to eat local and support your local community. So hopefully you guys will see more of our flyers around. And if you're interested in joining this farmers market support working group, let me know. We'll be starting up meetings very, very soon. Okay, and then now I'm gonna, any questions? I'll pause for 30 seconds. Okay, so now we're gonna dig into our pause working groups. And I'll pass it over to Julia, who led the Food Assistance Provider Advisory Group.
Yeah, so this is a group that we started, I guess really we started at the beginning of the pandemic when we launched this portfolio of our work. When the pandemic hit, we kind of saw a lack of capacity at the county level to kind of coordinate food assistance providers who were kind of on the ground doing emergency food assistance and needed some support. So we stepped in, we were working with DSS to kind of coordinate this network of food pantries and food assistance providers. We began meeting monthly. We've now switched to every other month, but really it's just an opportunity to kind of bring up topics, bring up discussion items, hear about what food assistance providers are working on, and figure out strategies to address some of their needs. And this has spurred kind of all sorts of other projects. We launched a cold storage initiative to support food assistance providers with cold storage needs. And we kind of simultaneously launched a smaller working group to kind of hopefully help support this larger network. So that smaller group was intended to kind of come up with call topic ideas for our regular food assistance provider meetings or advise on strategies and initiatives. That's kind of the background on that group. So, you know, in this past year, we launched a food assistance provider mentorship program. We secured more cold storage. We continued hosting our calls. We've updated our website and food assistance resources. So a lot of great work. But at the same time, we've kind of seen our numbers dwindle a little bit in terms of participation. So we're looking at strategies to kind of revamp this group in 2024. So we're rebranding it, so it sounds a little bit flashier, to the Food Assistance Provider Advisory Group.
And we're actively looking for new members. So we're hoping to kind of reform this group in the next couple months. We're looking for about 15 people to join and participate regularly in the meetings. And it's a really cool opportunity to engage in this work to help kind of steer the direction of it. So if you're interested in signing up, if you're interested in participating in this group, please do let me know. We'd love to get you involved, and we'd love to just bring in the new members and new participants to really make this work possible. So it's not just our small staff team, because essentially we really need folks who are working in the food assistance space, who are on the ground doing this work, to kind of help advise the work that we do so we can essentially do this work better.
Julia, what's the time commitment?
We'll kind of figure it out as a group. But I would say if you're hesitant to participate because of time commitment, just know that like we'll, try to keep our meetings limited. Hopefully not meet every month. I would say maybe every other month for an hour. We typically like to have some work that's done between meetings. But I think a lot of it hopefully will just be kind of showing up at meetings. So factor in maybe 2 hours or an hour a month, I would say. And maybe that would be an hour meeting every other month plus an additional hour for other work. Thanks, Bridget. Okay. Is that you or is that me? So our food rescue program, I won't go into too much detail about it because I know we're short on time. But this is a program we launched a couple years ago to support kind of reduce food waste and also support food assistance providers and help them access surplus food that would have gone to waste. So we launched this program. We use the Food Rescue US technology platform to connect food donations. So maybe it's a farmer's market that has leftover food at the end of the market day. We'll connect that to a nearby food pantry, and that food will be picked up and delivered by a volunteer food runner. That's kind of the overall gist of the program. We've been operating it for a couple of years. We have some of our impact highlights. It's doing somewhat well, but we're also kind of need to figure out how to restructure the program a little bit so it doesn't take as much staff capacity, and we can kind of rely on our community a little bit more to help us run this program. Essentially, we are a very small staff team, as you know, and we're doing a lot of different things. And operating this food rescue program really does take staff time and capacity. And so our idea is to hopefully kind of take a little bit more of like a network-based approach and maybe see if we can kind of divvy this program up into smaller kind of neighborhood networks and regions that have kind of a community leader in each of those places that can kind of help coordinate a smaller food rescue program in that area. Just an idea, but overall, we're going to be hosting a community meeting on February 22nd to kind of talk through ideas and really just brainstorm like, what could this food rescue program look like? How can we as a community and we as the Food Equity Council kind of help support this program and hopefully kind of transition it into its next phase. So if you're interested in learning more about the program and ways that you can participate and get involved, please do join that meeting. And Heaven can, maybe already did, drop the link in the chat. And it's also included on the screen. We'll also send out our slides. So don't worry about it. If you don't get it right now, we'll send out all this information later. But that meeting is on February 22nd. Heaven, anything else that I missed?
Nope, you covered it.
Awesome. Cool. And I see a few comments in the chat.
And then we also have our healthy food priority areas working group that is paused.
So I think Kim, are you on, Kim Stitchcomb?
Yes, I did make it. Thank you.
Great, thanks for being here. Are you ready to briefly share about this working group?
Absolutely. So I know Bridget mentioned a little bit of the work that the Healthy Food Priority Areas group did in the past, development of the Healthy Food Priority Areas map. And now it's time for just to update the data within that map. So the original version was launched in 2020. Now that we have new census data, we can update the map. So the Office of Information Technology has taken the lead on updating with all of those census data and coordinating with the Office of Food Security for other layers. And then right now we're working on relaunching that group for development of the next version. And what that means for us internally with the health department is to evaluate if the methodology that we had for defining the healthy food priority areas is best practice, or if there's any other method that we want to explore. So our next steps will just be to talk over all of the different options there and discuss it internally as a team, and then engage people for some more feedback, and then take that to see what kind of changes we can make as a result of this updated map.
Awesome. Thanks, Kim. Thank you.
Okay, so now we are opening up for a discussion. So a very quick one. So what's missing? Where do you think we are missing the mark? What can be added? What other areas should we add to our list of work? And we do have some ideas, but feel free to let us know if these work for you all.
And I'll just chime in. So historically, our work groups have kind of formed around a specific kind of policy or action area. They exist for a year, maybe more, and then often they sunset. So they're really, our work groups are not designed to exist forever. And I would say most of our work groups have existed for at least a couple years now, I would say. So we just wanted to kind of open up the conversation, and I know we don't have a ton of time, so this doesn't have to be the end of the conversation, but it would be great to hear from you on, whether the work groups that you're currently in, if you feel like they should still exist, and we should continue them, whether they should sunset, whether there are other working groups that maybe we should launch, if there are specific kind of topical areas that you're interested in bringing forward as a priority for the Food Equity Council. We're always, happy to bring in new ideas, work on different policy initiatives or programs or whatever it is. And so yeah, let us know. The work groups are kind of consistent and are made up of our members and community members. And they exist because someone in our FEC network had an idea and wanted to launch something, and so we did. So again, the ideas on the screen are just a few things that we jotted down that maybe would be interesting to launch. But nothing is set in stone, so we'd love to hear from you.
So, later last year, oh my gosh, I'm blacking out of names, but one of the founders of what's the name of the group? But anyway, it's like Welcoming America kind of concept. Like, since food equity, so you're like, how can we position Prince George's County that we are actually a county that are known to be welcoming to immigrants.
Yeah.
And how can you connect that to food security? Something like that. I don't know.
Yeah, I think that kind of ties in nicely maybe to community engagement, right? It's like, who's currently at the table? What are the initiatives we're working on? Who are we missing? What kind of outreach do we need to do to make sure other folks feel included? And we're also kind of listening to those community needs. I think that's always something I want to work on more. I think funding is often a huge piece of this, right? For me. So we're talking about kind of bringing folks to the table and having folks participate in our meetings more. Are there stipends that we could offer to make that more accessible and make that possible? So again, all sorts of things that we could definitely include into some kind of work group like that. And I think that's a great idea. Anyone else?
Deja, I see your hands raised.
Hey y'all, excuse me, I'm a little sick, so let me know if you can't understand me. I noticed in our district, District 1, we had some baby shower initiatives, and our food pantries offer diapers and things like that. So I'm not sure if there's a need, but it got me thinking about infant and maternal health, and how food can target those needs. And yeah, if it's something the council's thought about, or if it's already housed in a working group.
It's a great idea. It's not currently housed in one of our working groups. Potentially that's something that could be, maybe is already a focus of some of the Prince George's Healthcare Action Coalition's work. So Kim, if you're still on, feel free to chime in. Or it could be, I feel like, nicely added to some of the work that you're already doing. So, would love to hear more. And this is kind of bringing up, like, maybe, you know, for our future meeting, we could hear more in depth from Kim or other folks at PGHAC about kind of all of the work that they're doing, and maybe kind of to better align the work that the Food Equity Council is doing, kind of similarly to what we just did with the Office of Food Security, right? So we're kind of working a little bit more in harmony. But yeah, definitely something to consider. Just looking at the chat here.
Camille, I think the comments in the chat are from you, and I see you have your hand raised if you wanted to come on.
Oh yeah, sorry. Hi everyone. Yeah, I'm Camille, and I just had a couple of clarifying questions. So yeah, the first one was that were the intentions of the community engagement working group to ultimately get more engagement from residents in the FEC Council, or was it to just for general participation and feedback from the residents? So that was my first question.
I would say it could be both. And I know I see my computer is running out of battery, and we have a bit of a sticky situation with our cable, which is plugged into my my charging outlet. So maybe we can fix this, but we also only have 15 minutes, less than 15 minutes left of our meeting. So maybe we can finish it up in time. But yeah, Camille, to answer your question, I would say it could be both. I see it as both. But again, that could be kind of figured out among work group members.
Gotcha. Okay. Yeah, because I was just asking as far as you know, ultimately when being able to like collect surveys or get feedback, you typically see that there are a lot of people who are working in this space who really come to these meetings and giving their feedback. But I think that there's always opportunity to actually just get, you know, more feedback from just residents who may be not able to attend meetings or aren't as, you know, as involved as maybe some of us who are here today. And then, yeah, my second question was just more about the actual priorities of the work groups, like by year. So I know that there was, you know, ultimately went over the highlights for 2023, but I didn't know if there was a process to be able to set what are those priorities for each working group for each year, so that, you know, we just go into the next year with clarity as to what each working group's working towards. And so, yeah, that was just a clarifying question. So thanks again for your time.
Great question, Camille.
Julia, can I make one quick remark?
Yeah, go for it, Bridget.
In terms of maternal and fetal health, there's a federally funded program called Women, Infants, and Children, and it is open to everyone regardless of immigration status. And I want to highlight that. So if you click on the link that I posted, you can get a lot of information, and you can communicate with the program via WhatsApp and a variety of other ways to connect. So just wanted to share that.
Thanks, Bridget. Yep, an awesome program. So thanks for highlighting. Yeah, so Camille, to answer your question, yes, we do somewhat of that. We typically have our working groups kind of meet as a group and figure out what their priorities are for the year. So that's kind of, we kind of did we presented a lighter version of that during this meeting. And so we have those outlined in our work group and committees chart, which I think is linked in the agenda. And we can also share with you, and might need a few updates, but I think overall it's up to date, which kind of lists out what each of our working groups is working on and kind of what their priorities are for the year. So we'll make sure that that's updated and we can send that out to the group. But again, that's kind of a process that each of our working groups does internally each year to kind of move forward into the new year. And that's how we've done it historically. Again, always happy and interested in reiterating this and kind of figuring out other best practices and ways to you know, to work better with this group. So if you have other ideas, would love to hear that.
Okay, I know we're a little bit short on time and I want to make sure that we get to the rest of our agenda items. I think there's more of a conversation that needs to happen here about potential future groups. So. Oh.
She must have not plugged in fast enough.
Can you guys hear me now?
Yes.
Okay.
Yes.
And that you might need to hook up to the owl unless folks can hear me speaking.
Oh, yes.
Echo canceling speakers, everything else.
The video, the camera.
Yep.
Ooh, that should work. Okay.
You can expect me to put video too, so.
Oh.
So good.
Okay, great. So hopefully you guys can.
Well, there's things that Julia had a talk about nutrition education, because we've been talking about food itself, but.
All right, so.
As a one, well, maybe we can talk about that later.
So yeah, as Julia was saying, that we do need to dig into the work group and committee meeting a little, committee list a little bit more, but for the sake of time, I did want to highlight the Maryland General Assembly legislative tracking guide, which is also on the agenda. So for those of you who don't know, there's a food systems resiliency council. Okay, there's a Food Systems Resiliency Council in the state of Maryland, and they track during this time of year, they track food related legislation. And they meet every Monday, yes, from 1 to 2. So if you're interested in joining them, anyone can join, but I am in the agenda is linked the tracking list for you folks to take a look at for any bills that are being introduced. And there's also various committees that folks can also join. And if you're interested, I can also plug you into that. Moving along, we also want to highlight that the 2025 county budget listening session and hearing process is coming up on Monday, January 29th, from 6 to 8. We will definitely be sending out more details about this, but we want to share our draft asks for this budget listening session. So we're going to be asking assistance for local food assistance providers and to fund the public benefit program coordinator. And then also continued funding for the county's Maryland Market Money Program, financial and infrastructure support for food pantries and other food assistance providers, and funding for food systems planner and funding for food rescue. And we want to ask you all if there's anything else that you can think of that we should be asking out of this 2025 county budget listening session and hearing process. If so, please just come off mute or drop in the chat.
And can folks hear me? I think so. I'll just put a plug for work group and committee chairs. If you have ideas for kind of ways that, we could support your working group via funding and any requests that we should put in our testimony, please do let us know. It's a really important annual opportunity to kind of lay everything out, lay all of our requests out there for the county executive to hear. And so yeah, we'll be kind of compiling all of that into a more formal written statement. And then we'll also be expressing those verbally. So that will happen at the county executives listening session. And then we'll kind of reiterate those same requests during the county council budget hearings, which will happen later this spring. So please do reach out to us, if you have anything else that you'd like to include.
Yeah. Are you guys requesting money for the Food Equity Council?
We'll
in
request
general?
support for the Food Equity Council as well as kind of like our specific line item requests. Yeah.
Good, good.
All right, well, if we don't have anything else, I did want to move over to member announcements and next steps. So this is an opportunity for folks to share their announcements. Anything that's brewing in you guys' world, please share. I know that Liz is planning the Urban Farm Festival in April, if she wants to highlight that. Or if she's going.
Yep, yeah, so the festival's coming along nicely. The purpose of it is a couple fold. One, it is to provide the urban farmers and farmers in general, but particularly urban farmers, with the opportunity to access resources like the small acreage cover crop through Maryland Department of Agriculture, programs through NRCS, programs through Food Shed Capital, who is a CDFI that does some lending. And there'll also be demonstrations of innovative farming such as hydroponics, aquaponics, beekeeping, natural dyes, some different things that we don't necessarily see every day. And there'll also be some music, some relaxation opportunities for massages and tea tastings and things like that. And then we'll have a farmer's market and farm to food truck rally. So that creates some economic opportunities for the farmers to be able to partner with the food trucks, not only for sales for that day, but also to build ongoing relationships that they can take advantage of in the future. And this will be a really good opportunity for community members to just be more exposed to urban farming and maybe take some of those practices back to their own gardens. So if you would like to be a vendor or you would like to sponsor or participate in any way, please reach out to me. I'll put my information in the chat.
All right, thank you. Anyone else? And I also dropped the link to the festival in the chat. All right, well, I just did want to highlight that we are having our new member orientation on February 6th at 5 p.m. This is for folks who are new to the FEC or just want a refresher, want to learn how to get more involved. So if you are interested in joining that, the registration link is in the agenda. And I also want to plug that if you're not on our subscribe to our mailing list, please do. We like to have a comprehensive list of all things that are going on food related within Prince George's County and kind of Maryland. So it's a great way to stay connected, and also on social media. And then our next meeting will be
Our next meeting will be in April, so it should be April 23rd. And so let us know if you're not already on the calendar invite. I know some folks had issues with the calendar invite, per usual.
Yeah, perfect.
Awesome. And if you have any, topics or speaker ideas for that upcoming meeting, please do let us know and reach out. We'd always love to hear from you. And in the meantime, I'm sure you'll be receiving lots of emails from us, in particular Heaven, who's just been doing an awesome job communicating with you all and getting information out. And I know we kind of rushed through some of our discussion about our work groups and next steps for that, but we'll be sending out information, maybe a survey. So apologies in advance for another survey. But it would be great to hear from you all about kind of what you want to discuss and what you want to work on with these work groups. And I know a lot of folks that are in our network weren't able to join today's meeting. So keep your eye out for that, as well as lots of updates about the upcoming legislative session and opportunities to get engaged in that, as well as the county executive's budget listening session. And if you want to testify for that, do sign up by Friday, 5 p.m. So that's just a couple days from now. So make sure that's on your calendar. Okay. I I think with that, we are a minute to spare. Anything else? Anyone else in the room? Okay, we'll close it out. Thanks, Heaven, for helping facilitate today, and thanks everyone for joining us. Sorry for the technology difficulties, but that's what you get with a hybrid meeting. But I think overall it was a success. So we'll see. Hopefully we'll be able to do more of this in the future. So yeah, hope you have a great rest of your evening, and stay warm. We'll see you soon.
Thank you all.
Thank you. Take care, everyone.
Bye.
Bye.
Thank you.